Thank you for joining the webinar on advocacy and oral health. We will be starting the webinar in just 2 minutes. Thank you for joining us.
This is Corey. I can't hear anyone anymore.
We are on mute. Okay, ready to go?
Oh, okay. I didn't know people were talking and I just could not hear them. Thank you. Okay.
We ready? Hello and welcome to everyone. Thank you for joining us. You have tuned in to the Midwest Collaborative Initiative for 2018 webinar series number 2. It is on advocacy, most exciting and important topic that I think all of us are focused on in all kinds of ways. My name is Marcia Manter. I'm the Community Development Specialist at Oral Health Kansas and Webinar Coordinator for our Tri-State Oral Health Collaborative. We are pleased to offer a second webinar in the series featuring the outstanding contributions from Community Toolbox, hosted right here at Kansas University, just down the road from us. Thanks to our entire state partners, Patty Ulrich, coordinator of our tri-state work, and the 3 state partners leading and coordinating community coalitions in our states, Cheryl Thompson-Marsh from Michigan, Rosie McGovern, our colleague from Wisconsin, and Doug Bowman from Kansas. If you will take a look at the panel now on your screen, we'll move to the next slide. You will see the panel that allows you to track people who are coming, people who are here. Also, you will be able to type in your comments at the bottom or questions, and we will be monitoring them as we go. So if you can't hear, try turning up your volume or call in, and what is most important, because we're always asked, this is automatically being recorded. It will be posted on Michigan, Kansas, and Wisconsin's websites. It takes us a couple of weeks to get that recording up. Also, each of our panelists has offered us the information from their states, and we will have that also posted right along with the webinar, the recorded webinar for you to have. So we will have that information too. And we also will have the PowerPoints with some notes on them in a PDF version. So thank you very much for joining us. At this time, then, I would like to introduce the Executive Director of Oral Health Kansas, Tanya Dorfbrunner. Tanya has been working with us and the rest of the state, doing an amazing, and I would say kind of the rest of the United States, working on advocacy for oral health. So Tanya, thanks for being with us and helping to jumpstart the webinar.
Thanks, Marcia. And hello, everybody. I just want to start by kind of regrounding us in the overarching goals that we're working under, and that's the Oral Health 2020 goals created by the DenaQuest Foundation. As you probably know, as many of you know, Oral Health 2020 is a national movement designed to create a new social norm in the country about our oral health. It's designed to create a social norm that will join and integrate with the much larger network of leaders across the country working to improve the oral health of all. And every state in the country now is a part of the Oral Health 2020 network, and many of those states are participating in the webinar today. So you can see on your screen there the six goal areas for Oral Health 2020, eradicating dental disease in children, incorporating oral health into the primary care or primary education system, including an adult dental benefit in publicly funded health coverage, and that means both Medicaid and Medicare programs, building a comprehensive national oral health measurement system, integrating oral health into person-centered care, and then improving the perception of the value of oral health to overall health in the country. As you may know, there's a number of goals and targets underneath each of these, but these are generally the goals that kind of bind us all in our work. To achieve these goals, we as advocates, and everybody on this webinar as an advocate, will use a multitude of skills to advocate with local, state, and federal partners and agencies. For example, we may be advocating with WIC staff to help ensure pregnant women seek dental care, or with home visitors to include evidence-based oral health education in their curriculum. To ensure that oral health is covered in Medicaid insurance, we also advocate with governors, senators, representatives, and managed care organizations. And finally, working with the Children's Health Insurance Program and Medicare, both call for advocacy at the national level with representatives and senators. So as Marcia said, as the Executive Director of a State Oral Health Coalition, I know that to achieve our goals, we need advocates in every part of the state, each with expertise and commitment to our goals. And we're grateful today to Christina Holt, again from the Community Toolbox at the University of Kansas, for designing this webinar for our partners throughout the United States, and to the other three representatives from Kansas, Wisconsin, and Michigan, who are advocates of oral health in their own communities and states, and who are going to tell us their stories today. So I would turn that over now to you, Christina.
We are so glad that you all have joined us today for this advocacy webinar as part of this Oral Health Coalition webinar series. I am helping facilitate today's conversation from the University of Kansas Center for Community Health and Development, which is the house of the Community Toolbox, a free online resource for community change and improvement efforts. Today, I am joined by some incredible change makers from the Midwest Collaborative on Reinventing Oral Health. Tanya Dorf-Brunner serves as Executive Director of Oral Health Kansas, which plays an important role in advocacy in our state of Kansas and far beyond. Dr. Nick Rogers practices general dentistry in Arkansas City, Kansas, and as an engaged community citizen and leader, Dr. Rogers has led a movement to retain fluoridated water in their community. This effort recently received national award recognition. Michael Schwarz-Oscar serves as Executive Director of the Oral Health Partnership of Wisconsin, OHP's 53-person team of dentists, hygienists, and others assist over 10,000 children on Medicaid or uninsured yearly with their oral care. And Corey Taylor serves as Dental Health Coordinator at the Flint-based Genesee Health Plan, where she designed the senior dental program that provides dental insurance to seniors age 60 and older, including veterans who are residents of Genesee County. Corey was instrumental in increasing the income guideline so that more seniors are eligible for coverage than ever before. Corey also serves as coordinator of the Genesee Oral Health Coalition. Please join me in welcoming these panelists to today's conversation. Advocates plead in favor of a cause. They work often in the face of opposition for the things that matter to their local communities. Advocacy work can be a response to an injustice, a felt need, or an unacceptable situation. Often it is a cry for change. Sometimes it's an attempt to stop change. And often it's a demand for better laws or policies, recognition, increased funding, or better information. Advocating involves many things, including overcoming resistance and barriers to bring about or preserve programs, policies, and practices related to your mission. It almost always involves education and often involves activism. Advocacy means making noise, drawing attention to the issue, and otherwise proving to people the importance of your case. Learning objectives for today include review of guidelines for effective advocacy, practical advocacy techniques that you can apply in your own community of varying intensity, resources online that are available after this webinar to support your advocacy efforts, and learning lessons from real-world local, state, and federal level advocacy efforts. As we think about the conditions we want to change, it can sometimes feel daunting. But remember, it took American women from 1777 to 1920 to have the right to vote in all 48 states. As advocates, we must keep in perspective that change sometimes happens over decades or even centuries. So we are going to take our first poll here. We're going to take some polls to learn from you all today and to see who we have among us. So if you could please take a moment to indicate whether you currently see yourself as an oral health advocate. And the poll will be open here for a minute. Okay, and we'll go ahead and close that poll, Marcia. And Marcia, do you want to reflect on the results of the poll?
We're just pulling it up right now. Oh,
I got it.
Tanya, what have we got? Oh, we're having a little glitch here.
So 89% of the respondents said that yes, they do consider themselves to be an oral health advocate. 3% said no, and 8% said not yet.
Okay.
That's an outstanding number.
Absolutely. And we hope that wherever you are on your continuum of experience, you can take away some valuable lessons to apply to your current or future efforts today. Thank you. Okay, this quote from Johnetta B. Cole is apt for us today. Perhaps we should remind ourselves that the ultimate purpose of education is not to know, but to act. And certainly the purpose for our time together today is helping prepare for meaningful action. An advocate acts in favor of a cause, usually calling for positive change, and often working in the face of direct opposition. Advocacy in the context of community work often involves getting a large institution to correct an unjust situation affecting people in the community. We will take another poll, and this is whether you have ever worked on an oral health advocacy campaign. And Marcia, when there's enough responses, feel free to close that and report out.
Is it on? We're still collecting some responses. So we have about 50%. Oh, we have an amazing number of people who have been actually working on it, and then a few not yet. I always like that, not yet. We'll do another poll tomorrow.
Great, great. So we are going to hear from our panelists who are going to share about their own advocacy efforts, starting with Dr. Nick Rogers, who will be sharing with us about the Arkansas City effort to retain fluoridated water.
Well, good morning, I should say. Thank you for having me as a panelist.
First of all, our town is a small rural community in southwest Kansas, and what brought the fluoridation issue to the forefront. Like so many cities throughout rural America, the water treatment plants are becoming extinct or they're needing to be replaced. And the city was trying to raise the money through taxes to build a new water plant. The city manager's goal was to keep all the controversial out of the issue he could. So his plan was to get the water treatment plant passed first and then address the issue of fluoride later. The city commission had their first meeting to discuss just the water treatment plant. A week before the meeting, I knew it was going to be on the agenda, so a week before the meeting, I called the city manager just to make sure you're not talking about fluoride. And he assured me they would not. But at the beginning of the meeting, I decided to show up anyway, just in case. And I went there, and they have a moment, as most city commission meetings do, at least in rural towns, small rural towns, where they give the audience an option to say what's on their mind prior to when they begin the agenda of the meeting. And the room was full of people that were against fluoride. And even though it was not an agenda item, nor did the commission ready to speak on it, they all spoke against adding fluoride to the water. Most of the people were from out of state. They even brought in one small child that was disabled, and she had been given a written statement to read. She's probably 12, 13 years old. And although fluoride did not cause her issue, I think the visual impact that had was significant. Another factor involved in the discussion of fluoride is, would it cost the customers more money to use the city water if it had fluoride? And there's one industry, a meat processing plant in our community, that was opposed to it because they thought it would significantly change their water rates. So after that meeting, I realized the battle was on, whether we wanted it to be, or for that matter, whether the city commission wanted it to be or not. They tabled the meeting for 2 weeks, and again, they said they were not going to discuss fluoride. But however, I knew that there'd be those speaking against it, so we better be prepared. The first thing I did was to rally the troops. And the first thing I did to rally the troops, I called all the dentists in the community. We had a meeting in our office to discuss the matter. One of the things we discussed is who knew which city commissioner the best and who would be able to speak to them and get their ear, attention, and hopefully their vote. We discussed, we tried to identify other partners within our community that would support fluoride, such as the health department, hospital board, school nurses, and we listed all those, and we asked them to write letters in support of that. We discussed should we make a presentation? Should we have handout material at that particular meeting? And it was determined that all the dentists in the community would be present at the next meeting, and that when we had the chance to speak, prior to the meeting beginning, at the same time the other anti-fluoridationists speak, we would have our presentation ready. We decided, we appointed a commissioner to each, or we determined who knew which commissioner the best, and we decided in the next 2 weeks they would be contacted. And then we decided that we'd make a handout. And I think it's on the next slide, it shows which will be up in a second. It shows, thank you. It shows the cover, at least on the right, is the cover of a notebook that we prepared. Having only 2 weeks to make it, I spent the weekend sort of just gathering material and putting it together. We tried to, I also, in that week prior to the weekend I put it together, we turned to different organizations for advice. I called the Kansas Dental Association. I called Oral Health Kansas, and they led me to the Kansas Department of Health and Environment, a lady up there that had a lot of data that compared caries rates between cities within the state. I turned to the American Academy of Pediatric Dentistry and Children's Dental Health Project, sort of a think tank out of Washington as an advocate for oral health. And once I gathered that, we put this pamphlet together. And one of the things that I felt was the most helpful, I think we're going to talk about later, I saw it on the slides, was actually the graph that we had from the Kansas Department of Health and Environment. We made a copy of this handout. Actually, it was a nice notebook, and the cover was, again, on the slide in front of you. and I used my grandchildren because I didn't have any consent to use anybody else's picture at that time. And I handed one to each of the commissioners. I handed one to each member of the press that was there. And I will say that turned out to be real valuable because the local newspaper took my cover letter and printed it almost verbatim what I had written. So it was a great thought on one of the members' parts to use that handout. We also decided, that we're going to use, somebody had to be monitoring the opponent's communication. And in our community, Facebook was just bombarded. Also, letters to the editor in the paper appeared, and we tried to assign somebody to counteract, or at least to provide the facts, our side of the facts. But at any rate, it ended up being voted on because of some of the communications that we'd had with some of the commissioners. We encouraged them to, do you want to discuss this fluoride issue for the next 6 months, or do you want to just get the vote out of the way as you vote for the new treatment plan? And we encouraged them to just make the motion to include the fluoride equipment that was needed in with the proposal for the new treatment plan. They ultimately did it, and it passed 4-1. And it was just a team effort that made it, in my opinion, very successful. And there were some lessons learned, but that's probably for a little bit on down the road. So thank you for listening to my story, how fluoridation came to be in our community.
Thank you so much, Dr. Rogers. What an incredible story. And we will look forward to learning more about this as we continue through the webinar. Next, we are going to be hearing from Michael, who is the Executive Director of the Oral Health Partnership in Wisconsin.
Well, hello everyone, and thank you for participating in this call. I'm out here in Green Bay, Wisconsin, where it's about 20 degrees. I guess I want to say that I'm sorry that you have to be on this call and have to prepare. I think, as you heard in some of Dr. Nick's comments, there is a very vocal and growing base of people who believe that fluoride is detrimental to people's health and doesn't have dental benefit. Those people believe very passionately, but they're wrong. And it has been shown that they're wrong in so many ways. So in Green Bay, Wisconsin, the debate came up. And I think I want to start by saying you all should not ever discount that the advocacy efforts on the part of the opposition will be taken seriously and will happen really strongly, even though they have a lack of different scientific evidence and other things that we'll get into. It is a battle, and it's difficult when you're dealing with so many people in city councils. So I urge any of you, those not yet 13 people, and those of you who are in, fights right now, to take the other side very seriously and prepare thoroughly. So later in the presentation, we'll talk about that. In Green Bay, Wisconsin, we had a number of people who were very much against fluoride in the water. We've had it for about 40 years now in our water. Most of the United States has had it 60 years. We used a strategy of constant engagement. So you heard Dr. Nick say he went to all of those meetings. You have to do that. I mean, really and truly, even though it's so hard and they don't make the vote until the last meeting, any and every meeting you can get to with the city council is very important. We brought together our community collaborators. We're fortunate to have a fluoridation expert on our team. Jenna Linden is our clinical director here. We gathered all of our best resources. And then so we went through these meetings and we showed how here's all the information, which those materials are posted for you. We talked a lot about how the anti-fluoridation activists, didn't believe in vaccines and thought it was a government conspiracy. We didn't try to engage them on any personal level. We didn't question their motives. They questioned ours. They thought a nonprofit dental clinic was somehow into fluoridation for the money. And of course that was hurtful, but we kept it very fact-oriented. And then we brought in dentists and people from the state. So that was so wonderful to come and talk to folks. We had help from around the nation come in, as did the anti-fluoride people. And ultimately, when we went to our city council vote, because of going to all those meetings, we were able to say that the people who supported the fluoride believed in conspiracy theories. They believed, almost like the flat earther type stuff, where they just had all these ideas. And the 2 days before our actual hearing, the EPA came out with a 40-page ruling. Normally, the EPA would have just said, hey, no, we're not, taking fluoride out of the water because 60 years of science has proven it's wonderful and good for teeth and not bad for health, all that. Rather than just saying that, they wrote a 40-page rebuttal of all of the junk science that the anti-fluoride people were using. So we were able to point to that. We were able to say these people believe in conspiracy theories. And one point I want to get in for sure, in case we run out of time, is we brought up the fact that, hey, in Flint, Michigan, when you hear the lead, you see all sorts of legal actions with lawyers trying to get money, kind of the ambulance chaser type thing. What do you not see with the fluoride debates? You do not see people bringing lawsuits against the city, the state, the Fed to say, oh my gosh, we're going to sue you because of deleterious health effects of fluoride, because there's no lawyer who will take that on, because the science is incorrect. So we're fighting a PR battle where they're just trying to convince people with fear, and the burden of proof is not on them, which is why no lawyer will take it on and pursue these financial things. So I hope that little nugget helps you all, as well as all the resources and the fairly recent EPA, Environmental Protection Agency decision to say, here is why fluoride is absolutely helping our population. So anyway, I'll leave it at that.
Fantastic. Thank you so much, Michael. Next, we are hearing from Corey Taylor, who is the Dental Health Coordinator at the Genesee Health Plan and the Director of the Genesee Dental Coalition. Corey, you're on.
Okay, I'm sorry. It took me a moment to unmute myself. Hello, everyone. So if I may, before I start speaking about the senior dental program, one thing that we did have, just as it relates to the previous presenters, we did have a very similar fluoride issue here in Genesee County with the people opposing the fluoride being added to water from the new KWA Water Authority. And so we did get together with the coalitions here, as well as the dental professionals, and attend the committee meetings and the hearing, and the fluoride was ultimately placed in the water, and that was something recent that happened here. We did have the opposition present at the committee meetings and the hearing as it relates to what they feel are negative effects of fluoride. So I'm glad to know that we're all kind of in this thing together and operating in the same way as we all should. So the other thing I wanted to talk about was the Genesee Health Plan Senior Dental Program. It was identified here in Genesee County. We had seniors ages 60 and over, as well as veterans in the community who were aging out of their traditional healthcare and dental insurance benefits. And so as they were to get Medicaid and Medicare, they still did not have a dental insurance benefit. The Genesee Health Plan is able to offer a free senior dental program in partnership with Delta Dental. And as opposed to being an EPO or something related to Healthy Michigan, where we would have a reduced provider, the fee schedule, we are actually able to offer this to our clients, to any dentist who is already a Delta Dental Premier provider, or a Delta Dental, someone who's on the Delta Dental PPO provider directory. Initially, our income guideline was at about 135% of the federal poverty level, which meant that they could make approximately $1,300 for a single family household and qualify. And from what I noticed in the community, we have a lot of seniors here who actually have retirement funds and they the income was more than would allow for them to qualify for the program. So we've now increased that to 195% of the federal poverty level, which gives us family size of one. They can make roughly $1,960 a month, or about $2,000, and still qualify for this program. And it is free, so they get all their cleanings, their x-rays, oral exams, and the emergency treatment is at no cost to our client. We actually pay the subscriber fee. I have actually looked at some other resources that are available in the community because this is only preventive. I am a dental hygienist, so I am in conversation regarding expanding some of what we provide so that perhaps we can cover the cost of other services as they are identified by the dentist that this population shows they are in need of. And so far, things are working out really well, and we've got a lot of positive feedback from those in the community. And just, again, trying to continue to expand the program is one of the goals that I have here, and also to continue to look at the needs of the community and make sure that we are doing a good assessment of the finances available that they have, the barriers that they have, to make sure that we're not just offering something that they don't have the ability to get to their appointments. So we look at any barriers that they may have that might include like their transportation, personal finances, and just I kind of lend myself more as a liaison and coordinator for our clients, and helping them establish a dental home and creating a good relationship with them and their dental provider so that they will continue to receive dental treatment.
Thank you so much, Corey. Now we're going to be hearing from Tanya Dorf-Brunner here in Kansas.
So thanks a lot, Christina, and I've learned a lot already, so I hope everybody else as well. I want to share a little bit about advocacy from kind of the statewide perspective. Oral Health Kansas, as we've mentioned already, is the state's oral health coalition, but because we do not have a formal membership structure, we talk about ourselves as an advocacy organization. And as you can see here, our mission is to improve oral health through advocacy, public awareness, and education. But we truly believe all of our work is advocacy. Advocacy really isn't just about changing policies, it's about building relationships, and we think that means usually before you need them. It's also about educating people and service systems and working towards changing perspectives. So for example, think about how we now all expect, actually I'm not quite ready for that slide. Think about how we now all expect indoor areas to be smoke-free. The advocacy to enact Clean Indoor Air Acts did not start and end with pot laws being passed. It happened because advocates worked slowly and carefully over a long period of time to build alliances at every level of government, and eventually it just made sense to most people that the law should change. So today I'm going to share just a few examples of the types of advocacy a state-level organization can do at the local, national, and federal levels. So now, I'll ready for that next slide. Thank you. The first example is something that's just happened in the last couple of weeks. Our organization provided testimony at the Topeka City Council. Topeka is our state capital where we are located. In favor of Tobacco 21. This is a policy that's been adopted in 19 other cities in Kansas, as well as you can see to over 200 cities across the country. It raises the age to purchase tobacco products from 18 to 21. Health and tobacco cessation advocates organized the advocacy effort, and we were just happy to be a part of it. I ended up being the first person to testify on the first day, and that allowed me the chance to be asked to be interviewed for the evening news. So you can kind of see a little clip of the news story there. So since then, actually, our policy director reached out to each member of the Topeka City Council, and then just last week, the ordinance passed by a vote of 8-2. So it was kind of an overwhelming success and a good chance to do something at the local level. So the next slide is an example of some recent advocacy and ongoing advocacy at the state level. There we go. Thank you. Kansas is in the midst of renewing our Medicaid waiver for our managed care program, which we call CanCare. the state sought public comment about their renewal plan, and we decided we wanted to make the biggest impact possible by submitting comments jointly from all the major dental advocates in the state. So we submitted comments on behalf of the Kansas Dental Association, the Primary Care Association, and Oral Health Kansas. And then the week after that, I also was able to testify about our joint comments, and then learned that the committee, the legislative committee, is actually going to recommend that comprehensive adult dental services be studied in the 2018 legislative session. So another example of how partners can work at the state level to really get something done. So next slide is a federal example. And this was just a fun opportunity. We have not been terribly involved at the federal level in the past, and are really dipping our toes in there and starting to get involved. And so I want to share ultimately a couple examples of the work we've been doing. So we started by, in October, 2 of our staff took part in Oral Health America's Day on the Hill in DC. Before that, as I said, we hadn't really reached out to our congressional delegation very much. During our visits, we were actually able to meet directly with one member of Congress, Representative Lynn Jenkins. A week later, her office called and asked if we could arrange for her to see one of our oral health programs in the community when she came back home for a visit. So we quickly organized a meeting of the very first bilingual brush book bed group in Topeka, and she had a good time learning about what the families do to create bedtime routines involving brushing teeth and reading books. And as you can see in the little picture on the far right, she was actually having a lot of fun dancing with the kids too. The next slide is a couple more examples at the federal level. As you know, well, really, this is all about how engaging a network of partners is kind of critical to make a big impact. And so, as everybody knows, we've been talking for months about the need to reauthorize CHIP. In Kansas, we decided it's not just the work of Oral Health Kansas, but we'd been talking with several of the children's advocacy organizations in the state about reauthorization. So we decided that in addition to coordinating messages, we really wanted to work together to create a Twitter storm in September to urge our congressional delegation to reauthorize it. Of course, you know, it hasn't happened yet. We got a lot of assurances that they are interested, but nothing's happened yet. Ultimately, 15 states ended up participating in the Twitter storm, and this level of engagement, again, would not have been possible without the strong partnerships both within the state and then across the Oral Health 2020 network that I described earlier. The last slide is an example of some federal level advocacy we're planning in the future. So this is just kind of a preview, and we're excited to see where this is going to go. What we plan to do is to get involved in Medicare dental benefit advocacy. We've, again, as I mentioned earlier, this is one of the goals in the Oral Health 2020 movement. We at Oral Health Kansas had been talking for a couple of years about the need to urge older Kansans to contact members of Congress as well as the state AARP chapter about the need for a Medicare dental benefit. Our theory all along has been if we can mobilize people at the grassroots level, we can make an impact at the federal level. So we were thrilled to learn earlier this year about Oral Health America's model to do just that. Then next year we plan to launch a pilot project that emulates their model of educating Kansans over 50, or essentially educating baby boomers about the lack of a Medicare benefit, and then spurring them to contact both their members of Congress and AARP to demand Medicare dental benefits. So we're excited about where that's going to go, and hopefully you'll start to see much more about that as we move forward. And I think with that, I'm going to pass it back to Christina.
Fantastic. Thank you so much to all of our panelists. I think this really adds to the richness of today's discussion, and hopefully will make concrete some of the practical guidance and supports that we are going to be discussing for participants' own advocacy efforts. So you may have gathered, but it's important to get involved in advocacy if you're trying to accomplish something that it doesn't look like you're going to be accomplishing in another way, or if folks are ignoring your requests for change. Sometimes, as you've seen in with Dr. Nick's presentation, sometimes the issues emerge from the community, and you have to make that decision about whether you're going to jump in and serve as an advocate for the counterpoint, for example. You do want to make sure that you have the capacity and energy to carry it through and be involved for the long haul. You've heard some of these ingredients in the examples, but several ingredients that make for effective advocacy include that you're dedicated to the rightness of the cause, that you've gathered the information and you are passionate about the importance of the issue. Also, having powerful advocates, people who can speak to the issue, not only from a data standpoint, but really speaking to people's hearts through sharing of stories. Of course, understanding your opposition, and we'll get into some more detail about that, and understanding the climate of your community, as well as understanding what different types of advocacy methods and tactics are available to you. We are going to look at some different guidelines that help inform effective advocacy, and I will be asking my panelists to be reflecting on which of these guidelines were most important to their efforts, and to kind of share with you how they saw that guideline relevant to their own efforts. So starting with accentuating the positive, the good that you're trying to accomplish, to emphasizing your organization's values and accomplishments that you've already had in the community. It's also important to plan for small wins, plan for those tangible and controllable changes that can help your constituents feel progress and be excited about remaining involved over time. It's also important to present or frame the issues in the way that you want others to see them, and to develop your own public identity. We've talked about the importance of really being able to understand your data and check your facts so that you can clearly articulate those to supporters and to those who are not supporters yet, and to have solid documentation to really protect yourself against counterattacks and have a solid reputation. Also, keeping the issue as simple as possible. We know the importance of being passionate and persistent. That lends energy to your movement, and persistence keeps your issues in the public eye. We've heard about the persistence of some of our colleagues in terms of going to those public meetings and being prepared to speak out if the opportunity presented itself. Being prepared to compromise, that helps us build with rapport and relationships. It fosters goodwill, and it also demonstrates that there's a reasonableness, and it may encourage broader support. And of course, seizing opportunities as they come and being creative with your own efforts. I thought that Dr. Rogers' example of, getting photos from his own community and creating that cover letter and packet to disseminate to folks was a great example of really personalizing the issues and using some creative communications to get local policymakers' attention.
Is it proper to just say, do you want to finish what you have, or do you want comments from the panelists as you go? I'm sorry.
Sure, go right ahead. Go right ahead.
One of the things that all of us that are in the oral health business, so to speak, whether we're advocates or program managers or dentists or actual practitioners, hygienists, I think we all assume we all know what early childhood caries is. We all know the devastating effects of dental caries. But, I'm not sure the average public understands that. I know in my community, I tend to focus on children because I see a lot of children. I am a general dentist, but I tend to focus on that. But the detrimental effects of decay affects everybody. But the one thing our community I don't think really understands is how much decay is in our community. They don't understand how early childhood caries is how prevalent it is in our community. And one of the things I try to educate them on is, yes, there's a need to fight tooth decay, and any way we can do it is important. I also presented the facts that early childhood caries tends to be more prominent in low social economic income groups, which of our community is 75% of our community. The children in our community on free and reduced lunches. Another high early childhood caries rate are the minorities, and we have a high, in recent years we've had a high influx of minorities in our community. And when and people don't understand how bad cavities can be. They think, oh, my child had 1 or 2 filled when he was little. But when you show them those photographs, like I think was on one of the slides earlier on that cover sheet, they go, really? Does that really happen? And I say, yeah, no, we see about 2 or 3 of those a week. And I also pointed out that I just took a sampling of pictures, and they're all children within our community. But I think those photographs meant a lot. It showed them that there really is a problem. I think for many people, they don't really understand how devastating the problem is in their communities. I'm sorry, I took too long, but thank you.
Thank you so much, Dr. Rogers. Some other important guidelines are being prepared to stay the course, not being intimidated, and persistence in the face of opponents who may have broad name recognition and perhaps even more resources that you do. It is important to try to look for the good in others, not casting your opponents as evil, but seeing from their perspective the good they are trying to achieve. Keeping your eyes on the prize. We've heard about, personal attacks might come up, but to avoid responding personally or mudslinging, and to really just keep your mind oriented on what it is you're trying to accomplish. Making issues local and relevant. We've seen some powerful examples of that. To paraphrase from former House Speaker Tip O'Neill, all advocacy, like all politics, is local. And getting as broad-based support as you can from the very beginning. And the last of our 20 guidelines for effective advocacy are sticking within the experience of your group members and what they're comfortable supporting. Trying to work outside the experience of your opponents, though, and making your opponents play by their own rules. Tying the group's advocacy efforts to other related events that are going on, and trying to enjoy yourself and the good that you're trying to bring about. So I'd like to hear a few reflections from any of our panelists who would like to speak to one of these guidelines and how it played out in their own efforts.
This is Corey. Some specific things that I looked at when you were presenting those guidelines for effective advocacy. This number 3, when plan for small wins. I looked at the program that was presented to me when I began my employment here, and there were several things that I thought could be done a little differently. And so just taking it one step at a time, I looked at that increase in the income guideline as being like a huge win. And it also let me know that I did have a voice and that they were listening. And so I was very excited about that. And number 8, to be passionate and persistent, just developing resources that you can share. And I try to go the extra mile with the clients, and I walk that mile with them, whatever that means for them, whatever needs that they have. If it's something, it has to be something out there that can help them. And so if they're not eligible for this program, then what oral health program are they eligible for? And really just trying to be an advocate to continue to educate the clients as well as the providers, the clients in terms of the importance of understanding the relationship between their oral health care and their overall health care, and then the providers, so that they're just not taking for granted that when this person walks in and say, hey, I received this from Genesee Health Plan, they're not saying, oh, we don't take that. Because if they're already on that provider directory, then they do accept it, and the client is eligible. But we have had that happen where they go in and they say, I received this from the Genesee Health Plan, and the provider is saying, well, we don't take that, as opposed to just that front desk person saying, well, let me look and see. And so just trying to work and coordinate things so that it's working for the greater good of the client as well as the provider.
Thank you, Corey. Any other reflections on any of these guidelines?
Yes, this is Michael from Oral Health Partnership. We are involved in 2 advocacy efforts right now. One's around an enhanced reimbursement pilot in 4 counties in Wisconsin. So working to get, rather than maybe 20% reimbursement, around 50%, which is just wonderful for our children, obviously. And then the fluoride, keeping fluoride in the water. I have around 4 of the things. First of all, the facts. I think that is one of our most important tools as we advocate, that we have our facts straight, that we are presenting people with the truth as much as we've been able to research it, and that we believe it completely. With the fluoride debate, they sow doubt and fear, and those can be convincing. But when you have the facts and you are so sure of the facts and 60 years worth of science, it's very helpful. I think along that same line, framing the issues in the way that you want people to see them. All we can do is talk about how many different professional organizations for the fluoride issue, for example, have supported the research and have talked about it and have done verified peer-reviewed studies. And so just bringing that kind of almost legal, this is why we're able to prove it. I love that you brought up look for the good in others and compromise, because it was important to validate the humanity of those people who were against fluoride and say, look, these people care a lot about what they're doing, and they have very convincing arguments. Unfortunately, they've stumbled upon some very erroneous information and now believe it ardently. But, you know, we can't let children and adults with very limited access to fluoride be negatively impacted by their misinformed beliefs. And the last one I'll do, so as not to go on too long, but I think the most important is building it together. For both of our advocacy efforts, finding the broad-based support. So with the fluoride issue, we had it kind of ready-made. People in state, people in our Children's Health Alliance, lots of different people came together, and that was so compelling because we had the children there, because we had dentists there. With our enhanced reimbursement pilot, there are people who are involved and interested, so we've been talking with them, forming coalitions, writing letters to people so that they can understand the enhanced reimbursement and what it's doing. So those would be some of the things I would touch upon.
Thanks so much, Michael.
This is Nick, and I'll make my comments really short, but I know that just the comments I had on paper after the meeting is the presentation. I made notes: be polite, courteous, and respect the other views. That put in parentheses, unlike today's current political venue. And then I said, don't argue. I didn't argue any of the facts. I just pointed. I thought one of the best resources I came about was the American Dental Association, and it has this book you can download, or pamphlet you can download, Fluoride Facts. And the fluoride facts, every question that the anti-fluoridation people came up with, they had the scientific response or where you could find it. So I didn't try to, and I've also learned over the years, fluoride being an emotional issue, I don't think you can ever win an emotional argument. You know, sort of like I've got my mind made up, don't confuse me with the facts. And I did not take the comments personal. You know, most of them were community members that I knew. Those outside the community, I won't say I didn't care about, but they didn't impact me near as much. But I think maintaining your credibility and your compassion for others, as Mike said, is very important.
Thank you so much. Fantastic. Participants, you should have in a packet that is made available to you a worksheet that looks similar to this, that provides you with a table for considering the different guidelines for effective advocacy. And you can use that tool to reflect on what you will do to apply the guideline in your own situation. It's perhaps some things you're doing already and perhaps could serve as a prompt for thinking about some new practices as well. We've heard about the importance of preparing for advocacy, really understanding how people feel about the issue on the different sides, and how the issue might link or divide different segments of the community. Doing this planning and research will help you with clarifying your goals and your tactics, as well as how you can most effectively communicate with folks. And as you heard from Dr. Rogers about, having the questions and answers from a scientific resource, having those sorts of things available that you can utilize to speak from. Of course, to be a successful advocate, you really need to know the context and understand what is influencing your opponents to take the positions that they do, as well as what forces might be influencing decision makers and what it might take for people to ultimately support your position. Ensure that you have the essential facts, things like the history of the issue and who is affected, being able to speak to the consequences of the issue and why it matters, being able to make an economic case for the issue, and of course the social impact of the issue. What the current barriers are, why it's something that needs to be advocated for, and then being able to know what resources you have available to you as you get into the advocacy efforts. I would love to hear from both Michael and Dr. Rogers about their efforts that helped them with the preparedness that we heard about.
Go ahead, Michael. I've been speaking first a lot, unless you would want me to.
Well, okay, I'll go first. Thanks, Dr. Rogers. I think your points, though, have been well taken, especially the can't win an emotional argument, and don't confuse me with facts. I could have used you during or probably before my divorce, so where were you then? I needed to hear that. I guess I'll focus more on the fluoride issue that we had in Green Bay, because it's a discrete, it's a one-time issue. Actually, probably will go on, but so the City Council did ultimately vote 11-1 to keep the water fluoridated. Kind of as you talked about, I think preparation was the most important thing that we did. And as probably many people understand, with the fluoride debate, you're almost thrust into the issue. But not discounting the seriousness or how much you have to prepare is important. And so as we framed our arguments in front of each of the groups, first and foremost, we decided to gather all of the resources, have the most recent data, the facts, the figures that really are available, and you'll hear about those resources at the end of this call. But then we took those materials with nicely written emails, friendly emails to all of our alder people and said, please consider this. We know you're getting inundated with things from the other side. Here are these resources from these verified agencies. Then when we were in person, I think we started by talking about how important the issue was and how children, poor children, would have negative oral health consequences. I think it was important to establish our motives, and our motives are we want this to keep children healthier, even though it means less business for us, because the opposition called into question our motives somehow. So that was important for people to see that we're a nonprofit, we're trying to work for the benefit of children. With that engagement, we emailed those alder people the resources several times and in several different ways. We put out social media campaigns and lots of private calls and meetings with city council members to say, hey, do you understand this? And kind of, are you on our side? Do you understand what this means and how important it is? We shared all that information time and again with media and with the alder people. And then I'd say maybe the most important thing we did while we prepared was figuring out who can show up to those meetings, which groups, because they'll bring 20 people, national people, you know, children, all sorts of things. So we brought the children, we brought dentists, we brought workers from the water departments to counteract some fear, you know, arguments that the other side made, and that was really important. You know, I think it was critical to pay attention to some of the flaws in their arguments and just state them as facts and state them as, look, this is very conspiracy theory oriented, and here's why all this science is junk and the EPA has refuted it. We will continue to have to be prepared now. Potentially every year, anti-fluoride activists can bring this up and bring this to City Council. So we're going to stay current with the literature. We're going to continue to talk to our council members to bring it up. And just so you all know, the one council member who voted against it, that's kind of a thorn in his side now, because it is very conspiratorial, and we're going to bring that up, you know, when he is up for re-election and he's got a challenger. It's like, you believe that this is going back to the 60s and it's related to Russian power plants and all this, and you shouldn't have, you know, like that negatively impacts our population when you just believe things that aren't verified on the internet. So I don't know if that helps, but that's how we prepared to be advocates.
Absolutely, thank you. And I know with Dr. Rogers, I was struck by the similar, actually, Michael, to you all as well, just by the number of sources, you know, that were used to retrieve data and information to show the impact of the issue. And Nick, I was just wondering if you might speak a little bit to the sources that you were able to draw upon as you prepared for advocacy.
Well, thank you. Yeah, being somewhat involved in Oral Health Kansas and active dentistry, I did know some sources to go to, but it's incredible those sources led me to other sources. I mentioned them earlier in my comments, but you know, the Kansas Dental Association, for sure, if you have an oral health coalition in your state, most certainly I would touch base with them first, because they really have their thumb on what other organizations within the state are doing and other resources available. They led me to the Kansas Department of Health and Environment, which in all frankness, I would have never probably thought to turn to. But because they take surveys through different communities, they do have some accurate information as the cavity rates in different decay rates in different communities. So that was extremely helpful. And in my particular case, it was really helpful. I know that I think there's a slide coming up a little bit later that shows this, but it could compare our community to a community which is about 11 miles north of us, almost the same size and population, very similar demographics. We have fluoride, they do not. And when you show the untreated decay in the two communities, it wasn't just a little different, it was vastly different. Furthermore, they were able to compare it to the largest city in our state, which is Wichita, Kansas, which has never had fluoride, and their decay rate was incredibly higher than ours as well. But the Children's Dental Health Project, as I alluded to, is sort of an oral health think tank out of Washington, and I think it's a very good source. They led me to about 2 or 3 other sources, and the American Academy of Pediatric Dentistry. I used some of their materials as well. I also used some from Pew, and I just went through and tried to get all the information I could. I would like to, back to your comment a little bit earlier, as far as, you know, what did you do to prepare? You know, I think the most valuable, the one thing that I did that was probably the most valuable, if I could pick it all apart, is you know, just bringing all those that I knew would be for fluoride together to discuss it, and sort of we all had assigned roles on where to go, and we defined our strategy. And as Mike said, how are you going to frame this argument? I think that was probably the most valuable piece. The other valuable piece was talking to our city commissioners. Granted, in a small community, it's probably a lot easier than in Green Bay, Wisconsin, but we most of us know these people individually, and we have good relationships with them, and we can discuss the issues even over social events or just walk across the street in many cases. One thing we did not do, and we had the debate, do we bring in experts from the outside? In our community, I just felt like that would be more detrimental than helpful. We did not bring anybody in at all, and we just used basically the dental workforce as the experts within the dental workforce within our community as the experts. But thank you.
Thank you. So this is a little bit of a dance because we've heard of the importance of having accurate data and using that data to make a compelling case. I think this quote also reminds us, it is only with the heart that one can see rightly. What is essential is invisible to the eye. And the importance of also speaking to the heart through your advocacy efforts. It's also important to match your advocacy tactics with your situation, knowing your community, and with your goals in order to increase the chances of success, avoid wasting time and energy, and to minimize opposition. And as we've talked about, considering what the goals of your advocacy effort are. Additionally, there are different kinds of advocacy tactics that can be used. We've talked about the importance of conducting advocacy research and bringing things to light for the community. We've also talked about providing encouragement and educating people with the facts. Conducting a direct action campaign is can be more controversial, but can certainly be needed. And so things like collecting petitions or writing letters to the editor or Twitter storm, as we saw, and considering how to use the media to promote your advocacy efforts. We won't go into great detail in all of this because I think we're hearing so much from the real world examples that that really bring it to light. But a few of the things to hit on are really studying the opposition and understanding what their interests and tactics might be, and acting as a watchdog, so being able to keep track of and report on things that are happening. So for example, the case of, in the case of Dr. Rogers, the number of cases he's seeing each week of children with severe decay. And you can also organize some circles of people that get together to examine the issues together and figure out how to most powerfully make those cases. This, yes, please go ahead.
This is Nick, and I just wanted to say, you know, probably one of the biggest supporters of our cause, what at least ended up to be the newspaper, because of the material we had put together and the cover letter within it. Like I said, they printed that thing word for word, and it was an incredible help to have that on the front page, you know, the front page article. And I think, you know, forming a relationship with the media early on, and that's part of many of the things you've already said, be credible, be compassionate, but also have the facts. I think that helped us so much with the media, and I think the media really probably helped sway the issue to our side. Thank you.
Fantastic. And what I have pulled up here is are the graphs that Dr. Rogers shared that really show the comparison community and how that unfluoridated water in the comparison community compared to their own community, and was able to use that in a powerful way to make the case for continuing to fluoridate the water.
The green was our community. This is Nick on that last graph.
And then Michael shared this resource from the Pew Center that will be available to you subsequent to this conversation when the information is available online, but was able to draw upon this to communicate what evidence shows in terms of, for example, the financial case for investing in water fluoridation in order to save on treatment costs, for example. So we can't really underestimate the importance of providing that education and encouragement. Michael, would you want to take a moment to speak about some of the materials that you all used for the public education?
Yeah, absolutely. And as you'll see in a later slide, we collaborated with a lot of different people to pull together these resources. I'm so excited to be able to share them with all of you, all the resources that the panelists have shared. And I encourage you to gather them and be ready with them. That said, a blank appeal to authority, the CDC said this, will not be enough to convince the people you're trying to convince. The opposition will say that the CDC is in cahoots with, I don't know who, but just that, everybody's wrong. And so even despite the fact that they will disregard a lot of the, scientific research or show why it's wrong, I think it's critical to provide these types of resources to your people again and again. So in this type of debate, the fluoride debate, the city council members will be inundated with information. And it's more a battle of opinions and ideas and experts at that point. So a lot of times, busy city council members won't be able to discern what information is credible or worthwhile. So in this, how fluoride works, we were able to get support from Wisconsin Dental Association. And I might add, if you're moving towards this, working with some of your state organizations to say, hey, let's be ready. Let's pull together what research we have. We were able to get other research from surrounding areas about this. If you go to the next slide, it talks about or outlines some of the myths that the opposition will bring up, and then kind of gives the truth and gives support for that information. So, there are some appeals to authority that work. I think just thinking, oh, well, we've got 60 years of science, that's not enough for a lot of people. And you'll need to appeal to dental experts, water experts, and then have all of these resources ready to go to refute their expert witness material as well. And it's not a slam dunk case. So I can't say that enough. It really is a hair raising, oh my gosh, all these kids might lose fluoride. So I think the motives of anti-fluoride people aren't questioned because they're crusaders trying to undo this big government evil, and people relate with that. I think it's critical for people to say, we are fighting so hard and giving you all of this scientifically backed information because we care about children and the dental health of children or adults. And there are no, I drink the water all the time. There are no deleterious health effects associated with it. And all our materials show that. You just have to kind of keep restating the facts, but also explaining your underlying motivation, because otherwise people begin to question that, I think.
Thank you. There is a lot more information available online to supplement what we're covering today, and direct action tactics are certainly one of them. In chapter 33 of the community toolbox, it goes into lots of how-to material for each one of these types of tactics. But as a group, as you're considering how to be most effective with the advocacy in your own community, you'll want to think about which of these might be most appropriate. So we've talked about a number of these: using personal testimony, conducting public hearings, organizing legislative advocacy, writing letters to elected officials, writing letters to the editor of the newspaper, conducting a petition drive. So there's lots and lots of potential tactics that are available to you in your community effort or state or federal effort. There are also a number of tactics for working with the media. We've talked about the importance of building those relationships and doing that before you actually need them, and supplying them with information, photos, news that they can utilize. And of course, you can also use paid advertising if you're not getting the earned media that you had hoped for. So just a quick poll for our attendees. about which of these tactics you have used. Conducting advocacy research, providing encouragement and education, conducting a direct action campaign, or using media advocacy. We'll give you a minute here to respond. And Marcia, just feel free to update us when most responses are in.
So you can see on the screen, I'm really glad we have this from GoToMeetings. It's a good way for us all to get the information all together. I think it's pretty exciting too, of the people who've been participating in this webinar, people's involvement, people's interest in advocacy. So thanks for voting, everybody.
Thanks so much. And we're going to move on to discerning the kind of your base and how far-reaching your support is. And that's an important thing to consider as you're planning for your advocacy efforts. You know, do you have sufficient members? The more members you have, the less likely the group will be ignored. And I like how Dr. Rogers shared about, for their community, it was important to have their stakeholders and people who are speaking publicly be local folks. Also, considerations are money and the credibility of those who are speaking for your group, appeal and network and your reputation in the community, and what skills the group might need. Michael, this slide shares a bit about some of the broad-based support you all were able to obtain for your efforts. You want to speak to that?
Sure, I can do so briefly. And none of my doing, but there were so many organizations who had already been involved in the fluoride issue and that we're well connected with. So for those of you on the call, if you're not connected, I recommend trying to call folks here and say, whether it's the fluoride issue or reimbursement rates or whatever issue it might be, getting in contact with them when the fluoride debates came and the big city council vote happened, and even before that with some of the meetings. Like Dr. Nick, we had a lot of different partners from around the state. We were able to meet beforehand, whether call or in person, and say, hey, I'm covering this, I'm looking at this, let's talk about this. And that made for a much more cohesive effort. And I think ultimately seeing, the Marquette Dental School, our big dental school in the state, all the different organizations with so much experience in dentistry and public health, why would those organizations do something to hurt children's health, when all they work for is that helped to convince some people who were swaying.
Thank you. Just to remind everyone of a quote from the Civil Rights Anthem, I know one thing we did right was the day we started to fight. Keep your eyes on the prize. Hold on, hold on. I want to bring your attention to a resource that is available in the handouts, and there is a worksheet for you to use after this workshop as you reflect on potential tactics that you all could use in your own situation, some reflection questions for you to consider as you select those. And I'm going to share a little bit, something that we've found very helpful in partnering with communities is understanding who are likely to be opponents and how they might resist or oppose the effort. And so, for example, are they trying to block changes? Are they trying to intimidate you? Are they trying to reduce your effectiveness, stall the initiative? So we call these the 10 Ds, and these are tactics that are likely to be used by opposition. Deflection, which is, passing the buck on to maybe another group that doesn't really have the authority to remedy the issue. Of course, delaying, denying that that there is truth to the problem. Discounting is suggesting that the problem you are working on is not really that important, or they question the legitimacy of your organization. Deception, of course, trying to provide confusion, maybe misrepresenting statistics. Of course, division, dulcifying or appeasing with maybe small or less meaningful concessions. Discrediting, we've heard about questioning of motives. Destroy and deal, which of course is coming to a compromise. So any of our participants want to share about any of these opposition tactics that you encountered in your efforts and how you overcame those?
Sure. This is Michael. I'll jump in. I think that when you identify some of these things that the opposition may be doing, it really is a potentially great point to get involved and to make that into one of the strengths of your advocacy effort. Because if the opposition is doing one of these 10 things, it really can become a point where you say, hey, they've tried to lie about what we're saying and question our motives, and here's why we don't have those motives. And that type of behavior by this group really kind of helps exemplify who they are, their tactics, and we're not going there. And furthermore, here's why they're wrong. So I think part of the tide started to turn when they really got, when we made apparent some of the 10 things that you have listed up here for us.
Thank you, Michael.
This is Nick, and we didn't, I think the best was the slide you had back there, just stay the course and keep the prize in mind. And we didn't really, like I said, I tried to avoid all debate, all arguments. I just stated my facts and relied on my credibility, the credibility of those that were with me to carry us through. Thank you.
Thank you.
And I'll just add quickly, it is the type of thing where you get nervous, your heart's racing, your hands are shaking because it means so much, and it's an active debate and that sort of thing. We were inundated with emails from the opposition questioning our motives, telling us how stupid and wrong we were, all sorts of things, to the point that it was harassment. And so we used those things as we could, and like Dr. Nick said, we stayed the course and kept speaking truth to power kind of thing, getting our truth out there, and not for us, but for the good of our kids. And that, as probably the last time I'll be talking, just thank you, everyone. And, it can be done even if you don't win the first time. You just keep at it, and it will continue to have to be a fight.
Thank you. A couple of things as we're getting close to our closing here is I would just encourage everyone to be thinking about what ways you will be evaluating your effort and kind of what indicators will signify success, and how you will be using information continually during your effort to make any needed adjustments. And nearly every aspect of community work can benefit from having an action plan that outlines the basics of who is going to be accountable for different things and who is going to do what by when. And one of the things that I've been so impressed with the different examples that have been shared is just the collaborative efforts. And I know that they spent time getting together and planning for what their approach was going to be, community, and then having different stakeholders volunteer to carry parts of that forward. And so if you have any questions about action planning, there are a lot of online resources that are available for that, but it's kind of putting pencil to paper and capturing what your plan is to help keep you on track. We do have a resource in your handout packet that looks a lot like this, where you can outline some of the advocacy action steps that you want to take, and some of the practical things like who will be responsible, by when, what resources will be required, and who will need to know about it. I did want to share about a few additional online resources from the Community Toolbox that are available after we close today. There is a toolkit on advocacy and a number of related resources online that go into much more detail about how to implement some of these things in your own community. And if you need it, the URL for the Community Toolbox is just ctb.ku.edu. And Marcia, I will let you take it from here.
Christina, Nick, Michael, Corey, thank you so much. This is the first time that we have engaged people from the different states, and they did an amazing job with so much information and so much detail. Again, we're very excited here in Kansas because we're very proud of KU, I shouldn't say K-State, KU, and also, and the Community Toolbox. Has been a delight working with Christina and with Jerry, and there will be 2 more webinars coming up in 2018. Right after this webinar, you will have an evaluation come to you, and so please complete that for us if you will. We will be posting the information and the packets, the handouts, as quickly as possible on our 3 different websites, Michigan, Wisconsin, Kansas, and ours is under Community Coalitions. We will then put on the recording of the webinar when we get it from GoToMeetings, and then we have our tech person who will put it on, and sometimes it's up to 2 or 3 weeks. Feel free to email me, Marcia M. Manter at Oral Health Kansas, and we will, if people often ask, is it recorded? How can I get the information? I can't reach it. So please feel free to do so. Thanks everybody for joining us. A great response to everyone. And again, the materials will be online in this coming week. I think what day it is, Tuesday. Again, Christina, Jerry, Community Toolbox, thank you very much.
Thank you so much, everyone. What a pleasure.